So, yeah, very good evening, everyone. Um, this is my paper that I'm supposed to present. And sorry, there are so many pop-up icon next to me. That is why I'm unable to. Yeah. So, black bodies in phenomenological bioethics, uh, cultural othering, corporeal uncanny, and ethical quandaries of blackness. So this is the article that is published a year before. So I thought to present based on this. So my broad area is on bioethics, narrative inquiry of bioethics, and I particularly concentrate on African American bioethics. That is one of the sub-theme of or subcategory of bioethics. You have other platform also, not platform, but then the other scopes also. But then yeah, so uh, I have a specific deck of well, once again, I have a specific deck of 44 or 45 slides, which with I will be dealing with this presentation. I will make sure I will stick with the slides and not deviate with any other examples or get diverted from the point. And I'll make sure I'll finish it within half an hour. Yeah. Now, the figure of an African American nurse is the ignored subject both in the level of self and body. The article construes the corporeality of black nurses as confluence of biological and cultural discourses under phenomenological bioethics. So, what are the aims of the paper is first we we are categorizing this paper into twofold. First, the philosophy of race, which it attempts to theorize the thematic and ontological intersection between phenomenological and black bioethics. So, what in precisely what it is, we are uh, you know intersecting two themes. One is phenomenological bioethics and black bioethics. Then it proposes ontic black bioethics and neologism. So to evince how the corporeal misconceptions such as race construct, bodily othering, and colorism becomes the cultural impediment of for black women healthcare professionals. Taking insights from the philosophical anthropology of race to understand the epistemic structure of scientific racism. So this is the theoretical construct with which we will be dealing with, substantiating with. Now, the second aim is on narrative inquiry of race and bioethics, which is to investigate how racial attitudes of white healthcare professionals and supremacist patients towards black nurses can be a potential trigger of cultural othering, corporeal burden, and ethical quandaries. So for this, we would be dealing with the theoretical framework of cultural phenomenology and related to which we will be dealing with somatic attention. Yeah. Now, we are going to close read these two novels. One is Take My Hand by Dolen Perkins-Valdez, published on 2022, and Jodi Picoult's The Small Great Things, published in 2016. Yeah. So agenda of today's presentation is like this. We are sticking with the subheadings of the paper, which are introduction, meeting the moment, um, towards ontic black bioethics, text and the context, cultural othering, corporeal burden, and ethical quandaries, and coda. We will be summing up things there. Now, in introduction, we will be dealing with the major terms and concepts that we are going to be, uh, you know, understanding, acquiring, perhaps more getting into the problem, which are phenomenological bioethics, black bioethics, medical racism, and corporeality of black women. Now, Phenomenological Bioethics. It offers insightful elucidation lying between biomedicine and existential domain of the patients and healthcare professionals. Likewise, Black Bioethics, the exploration of and interrogation of any events, ideal, technological advancement, person, or institution that directly or indirectly affects the health or well-being of black, loosely defined individuals or the black population. So the former title to Black bioethics as a phrase racially, it was called as African American bioethics. And in 2020, particularly during the time of Black Lives Matters, Keisha Ray, who's a assistant professor in Chicago University, let's say, she rephrased the title as Black Bioethics. So, medical racism, the systematic and widespread racism against people of color within the medical system and the biases held by healthcare workers against people of color in their care. Now, American Nurse Association has given their own definition to this medical racism, which is assaults on the human spirits in the form of action, biases, prejudices, and an ideology of superiority based on race that persistently cause moral sufferings. Now, when it comes to corporeality and black women, this is the point actually we will be entering to a very big question: how a corporeality, let's say the mind-body dualism, works in the space of women, perhaps black women, or whole as a gender construct. Because the anatomical whatness of human being is not crucial for the analytic of Dyson, and fails to ask about the to be, the unique way in which human beings concretely exist in the world. Precisely to say, when Heidegger was formulating or theorizing the phenomenology, the Dasein, let's say, which is a French word for being, and the being was not sexed, the being was not gendered. It was a more philosophical and more amorphous term, because during 1930s, the idea of race, the idea of gender, or the idea of being in phenomenology is very different. It is more they speak about, they interpret about the everyday action, the existence or the experience they acquire and they portray is based on everyday action and fail to cover a particular gender or the experiences of a particular gender. So Derrida laments that Heidegger remains silent to determine the ontic predicate of being and its relation, and point out the question of why Dyson wouldn't be sexed. Sociologist Brian Tuner clarifies that it is constantly an account that largely devoid of historical and sociological content. So this the very invitrate critical view on the corporeality of black women has been paid less attention, particularly in the context of health, in the healthcare context. Yes. So now we are moving to the next subheading, meeting the moment. Here we will be dealing with phenomenological bioethics and black bioethics. We are intersecting it, and the other in subdivisions, such as how do we decide the definition of race? This is more a philosophical question, and the ontology of othering and the ontology of colorism. Now, before moving that, we should understand why we are intersecting uh, this both the theme as a theme, different themes. Why we are bringing this together? when we bring this together, what could be the possible definition for this particular meeting point, which is the phenomenological and black bioethics intersect as an interweaving response by recasting the perpetual schema of racialized bodies under the manifold of ontological explications. Now, why we have to do this? The idea is to understand how corporeal misconception as scientific racism has co-opted in the healthcare culture, thereby valorizing the bodily burden and ethical quandaries of black women, black nurses, or perhaps broadly the black healthcare professionals. In this article, we are focusing on black nurses, of course, but it can also procure to find the agony of black uh, healthcare professionals. Now, how do we decide the definition of race when already we have an ontological status of race? It resuscitates the very question. Now, we can categorize race into two different camps, like normative camps, which you called as eliminativism and conservatism, and the metaphysical camp, racial naturalism, racial skepticism, and racial constructivism. Now, the thing is that naturalists, or naturalists or eliminativists, and the broad group who belongs to normative camp, for they strenuously object the biological conception of race. They assent it as social and political definitions of racial identity, mere social and political definitions. However, metaphysical camp, they ascribe to racial concepts and their medical value and believe that the idea of race is indispensable for understanding biological conception. So this is the problem. Here is the problem when, from a naturalist view, the metaphysical dispute leads to an ever-evolving persuasion of biological notions that strips off socio-cultural rationally from what we want our racial concepts to do, and so what ought to count as races. Through wide patients and authorities, it has authorities here, I mean white healthcare professionals also, it has also taken many forms to defame black healthcare professionals, especially women, and damage the black confidence. Thus, precisely paves way towards the notion of scientific racism. Now, let's move further into this point where we will be questioning the ontology of othering. The process scientifically crafting race reifies the cultural alterity of white healthcare professionals by othering the bodies of black women personalities. Race-based bodily othering is an enduring litany that affects black women in the healthcare institutions. It reshapes their physical attributes, and inferiorize the self while caring for the ubiquitous well-being of white patients. Now, it is not a simple distinction between self and the other. Let's say but it is a categorizing a reference self group and stigmatizing and blaming the others outside it. For example, the bodies of black nurses are often compared with mummy, the asexual, dark-skinned and androgynous woman with motherly personalities who served as a caretaker of white children and patients. Classic example is in the cartoon Tom and Jerry. There always appear a black woman, but in the screen, in the whole screen, the entire frame, they will just show her lower back and her leg. which would be a black leg. She will be having a typical African American voice, and she will be shouting at Tom to get back to a place or anything, but she will be an African American person. Now, how are we? This is one way of, this is one side of the othering, which is to uh, stigmatize and blame someone outside the self group, or making them as a non in a intersectional concept we call it as non prototypical group. Now, how are we to understand this otherness within the self? This is also very important, because if someone is being othered, then their self is also in their self, how they other themselves. That is also a crucial aspect. The inescapability of being or having a black body in the healthcare workspace became a burden for the self. Now, further, we extend this argument into the ontology of colorism. Unlike the collective rendering of bodily self, the distilled notions on skin color show how the imprint of history in connection with a single trait influenced subsequent thinking about human diversity. For black nurses, being black is a particular clinical duress while encountering white patients and healthcare professionals. Or, as Ahmed observes, the cultural currency of whiteness in the phenomenological endeavor becomes worldly. In this sense, the existence of black bioethics represents bioethics' failure to fulfill its mission. Now, moving to the one of the important aspect of this paper is towards ontic black bioethics. Of the many responses available, bioethicists, feminists, and philosophers have intellectually expressed the culturally driven ontological precarity experienced by the black female body. In the healthcare context, their tropes can act as the catalysts that help to view the unbridled racial impressions undergone by black women healthcare professionals. Now, let's take for examples feminist theorist Elizabeth Cross, whose famous work on corporeality calls them as volatile body. Lucy Irigaray considers such erratic nature as ontologically out of order. This also parallels with what Shelrick's metaphor, which is leaks and flows. Um, Jenkins theoretically constitutes the term ontic oppression, and philosopher Dunn didactically terms it ontic burnout. So, taking all the adduced arguments and the expressions together, we propose ontic black bioethics, a neologism to obliquely capture the intersecting views of phenomenological and black bioethics. So, why it is significant? It embraces the wide-ranging lived experience of black women healthcare professionals, including their ethical, emotional, spatial, and bodily challenges, quandaries, victimizations, and the need to voice complex clinical circumstances. The assumption is to know how corporeal misconception becomes the cultural impediment for black women healthcare professionals, particularly black nurses. Now, let's move on to the text and the context. So, as I told you before, we have chosen two texts. One is Take My Hand, the second thing is Small Great Things. Take My Hand by Dolen Perkins-Valdez it is set in the post-civil rights era, Alabama. It is about the black nurse, Sybil Townsend, and she belongs to black elite, which means precisely she belongs to an upper class black African American society. She studied nursing at Tuskegee University, works at Montgomery Family Planning Clinic under the white nurse lead Mrs. Seeger. She is assigned to inject contraceptive vaccine Depo-Provera to black minor patients, the Williams sisters, Erica Williams and India Williams. They belongs to a lower class, but she realizes that Seeger uses her as a scapegoat to unethically exploit the maternal bodies of black minors. This makes Seeger, here I have done a mistake. Here it should be the word comes as civil. Here, this makes Civil an unwitting victim of medical racism. Without their family's consent, Seeger further orders to perform them tubal ligation at St. Jude Hospital. Now, the next novel is it is situated in somewhere in the present century, contemporary milieu, at Connecticut. Black nurse name is Ruth Jefferson. Studied nursing at Yale University. She working as a neonatal nurse at Mercy West Haven Hospital under the white nurse lead Mary and her colleague Corny. So she has more than 21 years of experience in nursing field. And Corny assigned to monitor a newborn uh, Davis. This baby belongs to a white supremacist parents, Turk and Brittany poor, and she's ordered to monitor this baby at the nursery room on a Saturday. But Davis dies when she is monitoring, just monitoring. Davis was already diagnosed with MCADD, a rare genetic disorder which decrease the sugar level in the body. Or it is also called as genetic sickle cell disease. Technically, which is means the blood cells that runs in the hemoglobin blood cells uh, will not be shaped completely. It will be in a half shape. So this report was sent to a lab on Friday, but Mercy West received the results only on Monday. So Turk and Brittany accuses Ruth for murdering Davis. Now, let's enter to the analysis part. I know I have not given much justification to the novel because you might be having a lot of questions: how, when, where, etc. You can ask me in the end of the presentation. Yeah. Intriguingly, these chosen works on black nurses offer insights into their bodily challenges and their ethical and emotional dilemmas. The given premise of the arguments that we deal with, like the definition of race or ontology of colorism or ontology of blackness, self and other, everything, etc., seeks resonance and parallels with the racial cultural construct of black nurses while examining their corporeal experience and ethical dilemmas through cultural phenomenology. Now, I want you to read this instances because they are the instance that lead to a point of ethical dilemma. So Perkins-Valdez highlights the paternalistic hold of Seeger on civil during her attempts to save the Williams sisters. The instance goes something, to quote, "If you want to stay employed at this clinic, you had better get your act together. Because though you may think you are smart, I have two fresh resumes waiting in the drawer in front of me, and they are every bit as good as yours." Similarly, Picoult illustrates the inappropriate demand of Turk against Ruth when caring for his newborn Davis with a Megacile text. No African American personnel to care for this patient. Now, according to Sordes, cultural phenomenology is used to synthesize the immediacy of body embodied experience with the multiplicity of cultural meaning in which we are always and inevitably immersed. What is at stake in both the case of Sibyl and Ruth is that the immediate understanding about them leverages subversion through racial attitudes like apathy and hatred. Both instances enunciate how they attain the racial spectatorship over the corporeality of Sibyl and Ruth to idea fixate their physical appearance, voice, and colors as part of the cultural others. Let us move on to the next set of instances. Perkins-Valdez again highlights the inexorable condition of civil and other black nurses who succumb to the innumerable clerical and clinical errands given by Seeger. So they claim that we were coerced too. Similarly, Picoult's narrative closure explains shame, denial, and hatred. That nurse, Turk says, I don't want her touching my son again. For a moment, I honestly don't understand. And then it hits me with the force of a blow. They don't have a problem with what I have done, just with who I am. Now, Sardas is concerned with the cultural complexities of ethno-racial healthcare subjects in terms of their somatic attention in the clinical encounter. Somatic attention is characterized by Sardas as those culturally elaborated ways of attending to and attending with one's body in surroundings that include the embodied presence of others. If at one level Sibyl has been put on as a carrier of depot, while somatically attending to William's sisters, on the other hand, Ruth is affronted as a neonatal nurse due to her demeanor as African American, while somatically attending with Davis. Both instances emphasize how the problematized physical touch over the patient's body and sentient objects like injections and pills becomes a formative mediums of contact between body, object and body. The condition also elaborates that neither attending to nor attending with the body can be taken for granted but must be formulated as culturally constituted or constructed somatic modes of attention. Both instances demonstrate how medical racism is tactfully secured within the kinesthetics movement of black nurses. On this basis, the appreciation of Sibyl and Ruth obtain a corporeal reach when their bodies are proselytized into the contact of burden. Now, this is the most elaborative, instance or the very crucial condition experienced by black nurses. It goes like, the girl is only 11 years old, I said. Even if Miss Seeger doesn't know about the mistake, don't you think it messed up that an 11-year-old is on birth control in the first place? Since discovering the potential danger of the drug, I had given two more depot shots. My head was hurting over what I was charged to do to the William girls. So that why Miss Seeger uh, went after India? I was all cried out, but this dawning realization opened my wound fresh again. When why had I not thought of that before? Mrs. Seeger probably put the girls in three of these misguided categories: poor, black, and mentally unfit. Had I done the same, I had initially deemed the girls unfit to be mothers too, because they were poor and black, because they were young, because they were illiterate. My head spun with shame. So this is the first instance. According to Swinas, phenomenological bioethics, pursued via a study of the essential components of human personhood, will bring us to the question of what it means to encounter another human being. Seeger's peremptory uh, order to sterilize the Williams sisters not only reflects the medical malpractices but also the interpersonal strain over civil, that is, machinating civil against India and Erica. Now, this actually takes us into the ethical questions. How much a white nursing administration should or should not reveal to black nurses about their patients, particularly the pre-adolescent body of girls? How do they, nurses like Seeger, decide to corporeally internalize the nature of civil as someone who assists in defeminizing India and Erica? Is it compassion or schadenfreude or a combination of both? Let's move on to the other instance. Carney is paged from the nursery. An emergency. Monitor the baby for me. I stepped into the nursery, where Davis is sleeping off the morning trauma. When I look down at the bassinet again, Davis Burner has stopped breathing. Then my head catches up to my hands. No African American personnel to care for this patient. Is stimulating the baby the same as resuscitating him? Is touching the baby technically caring for him? Could I lose my job on over this? Does it matter if I'm splitting hairs? Does anything matters if this baby starts breathing again? What am I supposed to do? What am I supposed to do? And not supposed to do? Any moment now, Carney or Mary would walk into the nursery. They would see me interfering with this infant, and then what? Yeah. The concept of somatic attention as a cultural corporeal mode of apprehension signals lived corporeality as the manner by which one person engages with another. While the given instance appears to defend the confusion of black healthcare professionals, the real question might be why the corporeality of a blackness is a speciation. Despite being dexterous in in the nursing profession, the ethical dilemmas experienced by Rath recount her anticipation of encountering racial attitudes of Turk, while attending with the body of Davis. For Saveness, to be a nurse is not only to be a rational agent. It is to be an embodied cultural creature relying on intersubjective bond formed through what the phenomenologist calls being in the world. Even by conceding with the stance that attending with the body of Davis is greater than merely being in the world, or let's say in the clinic, the condition raises a question. If the conceptual knowledge of cultural difference has its limits, what ethical consideration follow? Together with the works of Perkins-Valdez and Picoult, the article elaborates on the questions of ethics, cares, and professionalism that baffles black healthcare professionals in healthcare institutions. Now, moving on to the summation. Set in different eras, post-racial war and the current milieu, respectively, the authors depict Sibyl and Ruth as spokespersons to explain how the identity of black nurses is reduced from a biographical subject to a mere decoy racial subject in healthcare institutions. By foregrounding black bioethics, the article discusses phenomenological bioethics as a nascent academic discourse that combines the lived and uncertain corporeal experiences of black nurses. In essence, the article construes the corporeality of black nurses as the confluence of biological and cultural discourses under phenomenological bioethics.